Welcome to our comprehensive guide on shoulder joint mobilization. In this video, we'll explore the anatomy, movement, and therapeutic techniques for the sternoclavicular, acromioclavicular, and scapulothoracic joints. Whether you're a student, therapist, or simply curious about how the shoulder works, this journey will give you valuable insights into joint play, pain reduction, and movement enhancement. Let's begin by understanding the importance of these joints in daily activities and how proper mobilization can restore function and comfort. Get ready to dive into the world of shoulder mechanics and hands-on therapy. Let's start with the sternoclavicular joint, a critical connection between the clavicle and the sternum. This joint plays a pivotal role in shoulder movement and stability. When functioning properly, it allows for smooth elevation, depression, protraction, and retraction of the shoulder. However, stiffness or pain in this area can limit your range of motion and daily comfort. Understanding its anatomy and movement is essential for effective therapy. In the next scenes, we'll demonstrate specific techniques to mobilize this joint and improve its function. To begin mobilizing the sternoclavicular joint, the therapist uses a precise hand placement. The left hand grasps the medial 2/3 of the clavicle, with the thumb positioned below and the fingers above. This secure grip ensures controlled movement and patient comfort. Proper hand positioning is crucial for effective mobilization and minimizing discomfort. Let's see how this foundational step sets the stage for the following mobilization techniques. With the therapist's hand in position, the next step is to apply an upward and anterior glide to the clavicle. This movement helps increase joint play and can reduce pain around the sternoclavicular joint. The patient is positioned supine, with the thoracic cage stabilizing the sternum. The therapist gently pulls the clavicle up and forward, encouraging better mobility and comfort. This technique is especially useful for patients experiencing restricted shoulder movement. Dorsal gliding is another essential mobilization for the sternoclavicular joint. The therapist stands beside the patient, placing both thumbs over the anterior part of the medial clavicle. By applying posterior pressure, the clavicle is glided backward, which increases joint play and supports retraction movement of the shoulder. This technique is particularly beneficial for improving shoulder retraction and reducing discomfort in the joint area. Moving on, let's explore the acromioclavicular joint. This synovial, plane-type joint connects the lateral end of the clavicle to the acromion process of the scapula. It's stabilized by the acromioclavicular and coracoclavicular ligaments. The joint allows for subtle gliding movements that are essential for full shoulder elevation and depression. Understanding its structure is key to applying the right mobilization techniques, which we'll cover in the next scenes. The acromioclavicular joint supports a variety of movements, including elevation, depression, and gliding. Its osteokinematics mirror those of the sternoclavicular joint, while its arthrokinematics involve dorsal gliding during elevation and ventral gliding during depression. Recognizing these movement patterns is crucial for targeted therapy and restoring full shoulder function. Let's see how these concepts translate into practical mobilization techniques. For dorsal gliding, the patient is seated in a long sitting position. The therapist stands in front, stabilizing the shoulder and acromion process with one hand, while the other hand's thumb applies posterior pressure to the lateral end of the clavicle. This technique increases joint play, reduces pain, and enhances shoulder elevation. It's a fundamental maneuver for patients with limited overhead movement or discomfort at the acromioclavicular joint. Ventral gliding is performed with the patient in long sitting. The therapist stands behind, placing the thumb over the posterior aspect of the lateral clavicle and gliding it anteriorly. This movement increases joint play, reduces pain, and supports depression of the shoulder. It's especially helpful for patients who struggle with lowering their shoulder or experience discomfort during downward movements. Now, let's discuss the scapulothoracic joint. Unlike the previous joints, this is a fibrous joint formed by the anterior surface of the scapula gliding over the posterior ribs. It lacks traditional ligaments but plays a vital role in shoulder movement, including elevation, depression, protraction, retraction, and rotation. Understanding its unique structure and function is key for effective mobilization and overall shoulder health. The scapulothoracic joint allows for a wide range of gliding movements: cranial and lateral gliding for elevation, caudal and medial gliding for depression, and additional glides for protraction, retraction, and rotation. These movements are essential for full arm mobility and functional tasks. Recognizing the direction and purpose of each glide helps therapists tailor their interventions for optimal results. For scapulothoracic joint distraction, the patient lies on their side, facing the therapist. The therapist's left hand stabilizes the acromioclavicular joint, while the patient's upper limb rests on the therapist's forearm. The therapist then applies gentle distraction to the scapula, increasing joint play and reducing pain. This technique is particularly effective for patients with restricted scapular movement or discomfort during arm elevation. In summary, effective mobilization of the sternoclavicular, acromioclavicular, and scapulothoracic joints is essential for restoring shoulder mobility, reducing pain, and enhancing function. Each technique requires precise hand placement, patient positioning, and a clear understanding of joint mechanics. Whether you're a therapist or a learner, practicing these methods can make a significant difference in patient outcomes. Remember, always prioritize patient comfort and safety during mobilization. Thank you for joining us on this journey through shoulder joint mastery.